Did you know that epilepsy is the second most common neurological disorder behind stroke? Besides medication, there are other treatments that can help patients control their seizures. I recently learned about those options with Dr. Samden Latu, director of the Texas Comprehensive Epilepsy Program at UT Health Neurosciences. Dr. Latu, it's great to see you. Thanks for joining us on Houston Life.
Thank you very much.
So, Epilepsy Awareness Month, we are in it right now in November. Let's get an overview. What is epilepsy? I know most of us consider this and really think about this as associated with seizures. What causes it and what is epilepsy?
So epilepsy is a tendency to recurrent seizures, and that is essentially what comprises the condition. There are a number of different causes. In many people, it's either genetic or a tendency through genetics. In others, it's a problem that's caused by some kind of brain disorder. It could be due to tumors, could be due to an old stroke, could be due to head injuries in the past causing traumatic brain injury. So any of these conditions that affects the brain is capable of causing epilepsy. It's very common. So 1 in 20 people at some point in their lives will have an epileptic seizure. But happily, in the vast majority, we can treat them.
It's really remarkable. 1 in 20, that's amazing to me. Let's talk about what these symptoms are. We're looking at the screen here. Temporary confusion. Again, Dr. Latu, I said in the beginning that we associate epilepsy with seizures, but there are various degrees and different symptoms. Can we walk through some of these? Because it's not always a seizure, a convulsion, right?
Yes, you are quite right. The most extreme manifestation is a convulsion where a person loses consciousness, falls to the floor, and shakes or convulses. But there are many other types of seizures. In some, there is just a very brief loss of contact with the environment, what we refer to as absence seizures. And there are many variations to this theme.
And when we talk about treatment options, and I know, doctor, whether we're talking about pediatric epilepsy or somebody that has this as an adult, treatment options obviously are case-by-case basis, but most people tend to think that this would be treated by medication.
You're quite right. In about 2/3 of cases, medication tends to work very well. Compared to just 20, 30 years ago, we have many drug treatment options for seizures. But in those in whom medical treatment doesn't work, we do have surgical options. So we can actually pinpoint the origin of the seizures in the brain, and we can either tackle them through surgery, or what we call resective surgery, or we can use new techniques which are non-invasive or minimally invasive. And this means the use of laser technologies, for example, to get rid of those areas that cause seizures, and even deep brain stimulation. So we put electrodes deep into the brain and stimulate the brain to stop seizures from occurring. So there are many options available these days for the treatment of seizures. And
people really can live with epilepsy and controlling those types of seizures. And the last one that you were mentioning, I want to say, is that sort of like a pacemaker for the brain, where it's really targeting that one area to turn it off, so to speak?
Yes, you're absolutely right. These are devices that function like pacemakers, but rather than pace the brain, they sense the occurrence of seizures and they short-circuit the seizures by passing a current into the brain. Correct assessment is extremely important, so we know what treatments to use for different patients with different types of epilepsy.
Absolutely, a case-by-case basis. We do want to let people know that you have a virtual event that's coming up, and that is coming up on Tuesday. The information is there on the screen. It's from 6 to 7. It is a free event, but you must register. And doctor, if somebody knows someone or if they've been newly diagnosed, this would be something really that would be beneficial to them, correct?
Yes, absolutely right. So this is a virtual education event for epilepsy awareness. It's Epilepsy Awareness Month. And the idea is to talk about the condition, the treatments that are available, what can be done to support oneself if you're living with seizures, or how you can support your loved one if they are suffering from seizures and epilepsy.
Well, it's great information and obviously some really wonderful advancement that's going on in the world of epilepsy. And Dr. Latu, it's always wonderful to chat with you. We appreciate your time today.
Thank you very much indeed.
And to learn more about epilepsy treatments, you can call 713-222-CARE and to register online for that free virtual event happening on Tuesday as well.